What are fibroids, and do fibroids have an impact on pregnancy or fertility? I am Dr. Sneha Sathe. I'm Clinical Director and Consultant at Nova IVF Fertility in Chembur and in Vashi. Fibroids are non-cancerous or benign growths of the smooth muscle of the uterus. Fibroids are very, very common among women of reproductive age. All women must have heard the term fibroid, either because you've been told you have a fibroid, or you have a friend or a sister or your mother or grandparent even having a fibroid. Fibroids vary in number, vary in size, and vary in location. A fibroid may be as small as less than a centimeter in size, or it may be as large as more than 10 centimeters in size. Some women have a single fibroid, while many women land up having multiple fibroids. What we are more concerned about is the location of the fibroid. A fibroid may be placed just beneath the lining of the uterus when it is known as a submucous fibroid. Fibroids which are present within the wall of the uterus, those are known as intramural fibroids. And fibroids which grow on the outer surface of the uterus are known as subserous fibroids. Not all fibroids lead to symptoms. You may have a fibroid and not even know about it. Fibroids that are present on the inner surface of the uterus, or fibroids which are large, may lead to symptoms. Some of the common symptoms of fibroids are heavy menstrual bleeding or irregular menstrual flow. Sometimes it may be associated with pain during periods, or lower abdominal pain, or chronic lower backache. Fibroids which grow to very large size may cause pressure symptoms. You may have frequency of micturition or even bladder or bowel symptoms. Fibroids usually do not tend to interfere with fertility. However, if the fibroid is present underneath the lining of the uterus, that is a submucous fibroid, it can interfere with implantation. So women who are trying to conceive, if we find that she has a fibroid which is submucous in location, she would most likely be advised to undergo a hysteroscopy and a myomectomy. Fibroids that are intramural and small in size, or fibroids that are subserous, don't interfere with pregnancy unless the fibroid is very large and leading to distortion of the pelvic anatomy or leading to tubal obstruction. Now, fibroid and pregnancy can be a whole different ballgame. Fibroids which are large can sometimes lead to increased risk of miscarriage or increased risk of preterm labor. Women with fibroids and pregnancy do have a slightly higher risk of having abruption. Sometimes, as the fibroid grows, when the pregnancy and the baby is growing, it can outgrow its blood supply, and this can lead to degenerative changes in the fibroid. The most common degenerative change that we see during pregnancy is known as red degeneration, and it can lead to severe pain during pregnancy, but this can be managed medically. So if you know that you have fibroids and you are pregnant and you are experiencing severe pain, it is advisable that you see your obstetrician as soon as possible. Not all fibroids need to be operated, like I said. But if a fibroid needs to be operated for any reason, either because you have symptoms or you're planning a pregnancy and the fibroid is likely to be interfering with your fertility or pregnancy, the surgery that is most often advised is a hysterolaparoscopy and a myomectomy. Sometimes very large fibroids which are difficult to remove by a laparoscopy may require an open surgery. So fibroids being very common, there is no reason to be afraid of fibroids. It is better to evaluate and undergo treatment depending on how many fibroids you have and how big they are and whether they are leading to any symptoms.